Hello, I'm Dr. Mark Simpson. We're going to talk about periodontal disease. It's one of the most common diseases worldwide that people suffer from. What we like to do, and we treat periodontal disease here in our office, is the first thing we do is bacterial testing. We have a patient with us today that has periodontal disease, and we're going to discuss about the treatment. So first of all, what we did is a bacterial test. We took a little sample of the bacteria in your mouth, as you recall, and what we then sent that to a laboratory named Hain Diagnostics that we like to use, and we get this report back. And what it shows us is that she's very high in these particular areas, and what that means is there's particular bacteria in her mouth that are contributing to her periodontal disease. Now, we've also talked to her a little bit about the fact that the way the teeth come together can also affect it. If they don't hit right together like they should, and maybe she has a premature contact, that can also cause the tooth to move and could loosen the tooth. So we want to look at both the functional part of it, but also the bacterial part. Now, the way this will work is that they've determined exactly which bacteria we're dealing with, and then they tell us that we need to use clindamycin along with our treatment. So what we'll do is start the patient on clindamycin, and then we do therapeutic root planing and scaling, which is removing all the deposits of the bacteria. We then use our laser, and what it does is kills bacteria, but it also re-encourages attachment of the gum tissue to the tooth. So the combination of these treatments is very effective in our hands. The way we do it is do the whole mouth at one time. Traditionally, the way it was done is a quadrant at a time. The problem I always had with that is that we were leaving all these bacteria in other areas while we cleaned them out of this area. So by treating the full mouth each time and having 4 separate treatments, we find it is the most effective therapy we've ever had. We're in fact actually curing people with periodontal disease. Thank you so much for your time today.